Hello and welcome back to revise GCSE history.co.uk. This is the third and final video in the topic of medicine in ancient Egypt, and in this video today we're going to be looking at the natural beliefs and treatments used by the ancient Egyptians. In the video today we've got quite a lot of information to get through, so I'll try and go through it as quickly as possible to make the video as short as I can. Okay, so knowledge of how the body works in ancient Egypt. The Egyptians knew about the heart, pulse, brain, lungs and blood, so that you can say that they had some knowledge of how the body worked. Like when you come to revising, you don't need to know specifically what they knew about the body, you just need to know that they had some knowledge of how the body works. They did not understand the proper roles of these parts. They didn't understand the physiology, which is how the organs work. They just knew where they were and a tiny bit about them. So the Egyptians described how the blood, flowed through over 40 channels. They described how the blood flowed through over 40 channels from the heart to every part in the body. This diagram here to the right shows that. So we've got the human body. This is what the Egyptians thought about it. Firstly, channels led from the heart, and they normally carried blood, air and water. So as well as blood, we've got air and water being carried in these channels. The Egyptians believed that disease was caused by undigested food rotting in the bowels. Rotting food let off gases which seeped along the channels, causing disease in different places and preventing the normal flow of blood, air and water. So normally, in the channels, we've got blood, air, water flowing, but when we get undigested food rotting in the bowels, this prevents the normal flow of blood, air and water. So just need to know a bit about that. So, disease caused by undigested food rotting in the bowels, and rotting food let off gases. So they carried blood, air and water. So that's what you need to know about the Egyptian channel theory and what they thought about how the body works. So the channel theory, and we've just very briefly looked at it here. This diagram gives a good summary of it, which I've made, this image. So the River Nile was important to the health of the farmland. You may remember from the Egyptian civilization video, we talked about how the River Nile and the irrigation systems led to them developing ideas in medicine. The River Nile was important to the health of the farmland. Irrigation channels brought life to the farmland. So doctors began to think of the body as having many channels inside it. So the body has channels, and they thought that someone became unwell when their channels became blocked. So if you're ill, they said your channels are blocked. Treatments were used to unblock the body's channels. And they believed that healthy channels were vital for good health. And this is quite an interesting point here. It's probably beyond the scope of what you need to know for GCSE history. But this point here, in ancient Egypt, an everyday greeting was, "May your channels be sound." I just thought that was quite an interesting point from the textbook. You probably don't need to know that, but if you can bring that into your exam answer, that would be really good, and would help your answer stand out from the examiner who's got to mark 40 exam scripts a night. So the healthy channels were vital for good health. They thought that you became ill when the channels of your body became blocked, just like the irrigation channels that were connected to the River Nile becoming blocked, and the farmland becoming unhealthy and unfertile. So treatments were aimed at unblocking the channels of the body. They did this using various ways. So when someone became unwell, various methods were used to try to unblock the channels of the body when you became unwell. So what ways could we use to try and unblock the channels? There were 3 ways they did this. 3 ways. And you may be thinking of some already, some common sense ways we could use to unblock the channels of the body. The first was bloodletting. This is the surgical removal of the patient's blood. So you might take a needle to the patient's skin and draw out some of the blood. This picture up here It's from a bit of pottery, Egyptian pottery, that's been found. You can see an Egyptian doctor using a needle or something to remove the patient's blood. That patient would presumably be unwell, and he'd be doing that to make him feel a bit better. Another method used is vomiting. A doctor would give a patient something that would make them sick, unblocking their channels, and purging. And this purging literally means to remove impurities, and this is usually done through feces. And all that feces is, if you don't know, is poo. So an Egyptian doctor would give a patient something that made them go to the toilet. They'd give him like a laxative that would make him unblock his channels through purging. And natural treatments were... Sorry, that's an error there. That could be a really killer mistake there. Natural treatments weren't accepted by all. Not everybody believed them. They weren't accepted by all. And those who did believe them still did not abandon their spiritual beliefs. So, not everyone believed that these natural ideas were right, and even those who thought they were right still had religious beliefs. So, a quick summary there. 3 methods we could use to unblock the channels of the body: purging, vomiting, bloodletting. PVB, BVP. You might want to make an acronym to help you remember that. Purging, vomiting, bloodletting. Okay. So, in ancient Egypt, there was a variety of treatments used. Some were natural, some were supernatural. So, just a quick little activity here. You've got to say which treatment is natural, which treatment is supernatural. So, the use of herbs, natural, supernatural. Yep, you're right, that's natural. The use of surgery. Yep, that's a natural treatment. The use of magic or charms. Yep, supernatural, that one. We've already talked about the channel theory, and that would be a natural theory. The ancient Egypts also knew diet was important. Certain medical procedures were recorded with recommended foods, so that again would be natural diet. Alright, so there's some treatments you need to be aware of. Here we can see that's shown in Egyptian farming, and these could be potentially herbs that were used as medicines. And here we can see some Egyptian surgical instruments. Egyptian surgery was still simple, but used as a last resort. Here are some historical sources that show some of the treatments used by the ancient Egyptians, and I think they're quite interesting, some of these. So let's have a look at the first one. You can read it, I'll just make that a bit bigger. Each Egyptian has a net. He uses it to fish by day, but at night he spreads it over his bed to keep off the mosquitoes. That's from a Greek historian who visited Egypt and recorded that information. So that's quite interesting. They were using essentially mosquito nets, but they were fishing nets. So they're using mosquito nets to protect them from things like malaria. So that's quite clever, that really. You wouldn't necessarily think that Egyptians would know about that, would you? But it's quite surprising. Here's an Egyptian medical treatment that was recorded on a bit of papyrus. So it involves these 3 steps: examination, diagnosis, and treatment. It says, if you examine a man whose nose is disfigured, part of it squashed in, the other part swollen, and both his nostrils are bleeding. Diagnosis, then you should say, you have a broken nose, and this is an ailment which I can treat. Treatment, you should clean his nose with 2 plugs of linen, and then insert 2 plugs soaked in grease into his nostrils. You should make him rest until the swelling has gone down. You should bandage his nose with stiff rolls of linen and treat him with lint every day until he recovers. And that was from a papyrus record, and this papyrus lists 48 cases of surgery, each with a careful description of examination, symptoms, diagnosis and treatment, similar to this. So that's quite interesting in understanding how Egyptian doctors examined the patients, diagnosed them and treated them in a way that we do today. Doctors still do things like that today. So that helps us to understand the natural treatments that we use, that source there. It's quite an interesting source again. Just bring this one to the front. Okay, so here's another treatment that's been found on a bit of papyrus. So for a diseased eye, to clear up the pus, we're using these ointments here, these herbs and spices. To treat its discharge, and to treat the growth, we're using these. I won't try and pronounce these. Well, they're not too bad, but some of them. So we've got honey, balm from Mecca, and gum ammoniac, frankincense, myrrh, yellow ochre, and to treat the growth, red ochre, malachite, and honey. For diseases of the bladder, bread in a rotten condition, given mouldy bread, the doctor must first use it to fight the sickness, the doctor must use it to fight the sickness, not to avoid the sickness. So that's talking about treating rather than preventing. So they could understand that some diseases could be prevented, but that's a disease that had to be treated once somebody got it. So that's quite interesting. Those three sources are quite interesting in understanding what the Egyptians understood about disease and how to treat it. So specialist doctors, we did talk a bit about this previously in the Egyptian civilization video. The rich could afford to employ doctors to look after them. For example, the pharaoh had his own physician. Specialist doctors spent much of their lives trying to improve their understanding of medicine and health. Egyptian doctors actually looked at their patients, writings survive that demonstrate that they included diagnosis in medical rituals. Like you can see from this source here, here we've got a clear examination, diagnosis and treatments. That's quite a clever way of diagnosing patients that we still use today. So this is still used by doctors today. And doctors use this in ancient Egypt. Quite incredible, really. Okay, so health and hygiene. Cleanliness was highly valued by the ancient Egyptians. They bathed, shaved their heads, and had toilets. They also changed their clothes on a regular basis, and that would make them cleaner. In the Egyptian climate, this would have made life more comfortable, although hygiene, whilst it is a natural understanding about disease and natural way of preventing disease, it had some sort of religious significance. And what we mean by this is priests wash more often than others. Sorry, not very good at underlining. Priests wash more often than others and shave their whole bodies before important ceremonies. So, although hygiene was a natural thing, it appeared to have supernatural significance. And we can see a source here that talks about Egyptian hygiene, and it's written by a Greek historian who visited Egypt. For 3 successive days every month, the Egyptians purged themselves, for they think that all diseases stem from the foods they eat. We're talking about that previously. They drink from cups of bronze, which they clean daily. They are careful to wear newly washed linen clothing. They practice circumcision for the sake of cleanliness, and their priests shave their whole body every 3rd day, so no lice may infect them while they are serving the gods. Twice a day and every night they wash in cold water. So that source talks about how the Egyptians kept clean and how hygiene had religious significance to them. So, this is the final video on ancient Egyptian medicine, and I thought we'd just do a quick summary of Egyptian medicine and everything we've done about it. A good way of summarising your topics as you go through the development study, Medicine Through Time, is to look at change and continuity. Change is what was different, what was new, and continuity is what stayed the same, what didn't advance, what was similar to before. So what was new and what stayed the same? So when we're talking about what stayed the same, we're talking about same as prehistoric age. So what changed? Well, there were now specialist doctors, and doctors looked for logical causes of disease and could identify some parts of the body. New herbs were imported and used as medicines. That's talking about trade and stuff like that. Metal instruments were used for surgery. People still had supernatural beliefs. They believed that... metal instruments used for surgery. And what stayed the same? What was the same as prehistoric medicine? People still had supernatural beliefs. They believed that gods and spirits caused disease. People did not understand how the body fully worked. They didn't know too much about it. And people still did not understand what causes disease. A good way of revising for medicine through time is to use these Venn diagrams, and I really like them actually. I'm just going to bring that to the front. Yeah, sorry, my text is in the way. These Venn diagrams are really good, I think. So, I'll just do an example. If we were to start filling this in, you could write for Egypt, there were specialist doctors. They didn't have them in prehistoric age, just in the Egyptian age. Specialist doctors. Prehistoric, they did strengthening operations. That's something that they stopped doing in Egypt. And thing that kept the same in both, they thought that gods and spirits cause disease. That's something that stayed the same. So these Venn diagrams, you could go on and fill them in and everything. These Venn diagrams are a good way of summarising your knowledge and what changed and what stayed the same. They're a good way of looking at change and continuity. And I'll be looking at those in future videos when comparing different time periods. So there's a quick summary of that then. I'll just move that, I think. I'll sort that out in other notes actually. Alright, so I've come to the end of this video today. As a quick summary, like I do at the end of all of my videos, just 4 quick knowledge recall questions to make sure you've got the stuff nailed for this particular topic. You may wish to pause the video here and jot down a few answers to these questions. If not, carry on watching and we'll go through the answers together. So, a couple of gap fill questions to do here. So, the Egyptians believed that the body contained channels, and we're talking about the channel theory, which was a new idea, and it came from the irrigation systems and the River Nile. Is theory spelt right? That looks really dodgy. What have I done? I might tidy that up in a sec, but I've put a H in theory. Sorry, that's it. It's supposed to be an H. I don't know what I'm on about. The body became ill when the something became something. When the channels became blocked. It's alright, I can spell channels. Treatments were, so these treatments focused on unblocking the channels. Just some extra notes here. That's what the treatments aim to do. They're aimed at unblocking the channels, and the treatments were purging, that's taking a laxative, vomiting, being sick. Sorry, that's a bit untidy. And finally, bloodletting. That's the surgical removal of blood. Okay, what were the ancient Egyptian attitudes to cleanliness? So, cleanliness was highly valued, and it seemed to have religious significance. There we are, they're the answers to the quick 4 knowledge recall questions. That's the end of all the videos on medicine in ancient Egypt. If you head over to my website at revisedgcsehistory.co.uk, you can continue watching videos for medicine through time. Next up in this series is medicine in ancient Greece. Thanks for watching, I'll see you later.